Hi, I'm Courtney Moore and I'm doing my presentation on drug addiction therapy. I love this topic because this type of therapy revives people who are slowly dying from alcohol and drug addiction. This is the career I am pursuing after college. It is estimated that over 25,000 people die each year from alcohol. This includes poisoning and homicides. Over 40,000 people die from pharmaceuticals. Including accidents due to driving under the influence, there are well over 150,000 people who die each year due to drug and alcohol. Emergency room visits have skyrocketed in just 1 year from over 600,000 to over 1 million. The number of deaths due to liver disease caused by alcohol is over 18 people per year, and IV drug use is one of the leading causes for spreading HIV in the United States. It is also estimated that there are over 2.3 million criminals behind bars in the United States, more than any other nation. 1.7 million inmates are locked up due to violating probation because of drugs or alcohol. I interviewed a substance abuse therapist named Shannon Grant, who has her MSW in social work at Unity Recovery Group on March 18th. Okay. So, what type of clients do you work with?
I work with clients who struggle with substance abuse problems. They are all over the age of 18, so adults with substance abuse issues.
Interesting. How would you determine the client's needs?
We start assessing areas of need before they come in to make sure that they would be appropriate for our program, so they're screened prior. And then once they get here, they go through assessments during detox, nursing and medical assessments, and we find out clinical issues during the biopsychosocial, and then we will come up with the areas that they need to work on and how we can address those areas from that assessment.
How is the service or treatment plan developed?
So from all the information that's gathered during those assessments is how we'll determine what the main problems are, and then come up with a treatment plan with the client. We have a lot of client input, so we know what they want to work on, and that's how we come up with the treatment plan.
So you said while they're in detox, you get all this information. So what level of care do you work at?
I'm in the IOP program, which is intensive outpatient, and before they come to us, they may have gone through detox initially to be medically stabilized, and then an inpatient or PHP level of care, and then step down to our level of care, IOP.
Okay, describe a typical case that you would have.
A typical case, we have a lot of younger clients in their early 20s who struggle with opiate addiction. Would be probably the most popular type of client that we have.
That's sad. Will you describe a particularly challenging case that you've had?
One that comes to mind was a female client who was younger, mid-20s probably, and she had a lot of anger issues and behavioral issues and would become super aggressive, so it was hard to intervene. It was very difficult for her to hear anything that was being said clinically, because she would just become very defensive, and it was hard to get past that initial wall that she put up.
Yeah, that would be challenging. How do you describe a successful client?
That is really hard to define, especially in this area. That's a really common question that we get asked from parents. Like, what is your success rate? And I always tell them, well, that depends on how you define success. Some people would say it's being clean for a year after the program, but I think really in my job, I'm successful if I plant some seed. Something that I've learned to do while in this level of care is really not be attached to outcome. So my job is to just offer the healing and the help, and I can't be so invested in what they do with it beyond here. So we just offer. So a successful client is someone who takes something from the program.
How common is success?
Well, if you define it as taking something from the program, I think a lot of people take something, even if they go on to relapse or have to go to treatment, you know, multiple times after that. I think they've probably taken something. But if it's staying clean right out of this program, it's hard. We have a lot of repeat clients that continue to struggle.
But do you think that when they seek treatment, even if they do relapse, you're making progress in their disease?
I think so.
Yeah.
Because I think it says something that they keep trying and they keep coming back, and they
might hear something different.
Yeah. And they've probably learned, you know, heard one thing that stuck, or, you know, one idea that even gave them the hope to come back and try again, or knowing that there's a place to go that you can try again.
So what are the most challenging aspects of your work?
I think the frustration when I forget to not be so attached to outcome, and when you see the same clients coming over and over again, and, you know, you can begin to feel like, what am I doing? Am I not even making a difference? But when you know, kind of remind yourself of all these things that that we're talking about, it makes it a little bit easier. And then just the everyday, like, behavioral issues of young people who are acting out and don't want to, or some people who don't want to be in treatment, who are forced to come, or so they just have no interest in being here at all, but they're still here. So those are hard to deal with.
Yeah, I can imagine. What would you say is the easiest aspect?
The easiest aspect is, a lot of people would probably disagree with me, but I would say the paperwork.
Really?
Because it's a lot and it's tedious, but I'm very, like, organized, so all of that is, it takes a long time, but it's easy to do. You don't have to think too much. It's very, like,
yeah, I feel like once you get used to doing it, like in the beginning, that might be hard.
Yeah. Once you get used to it, once you, like, fall into a schedule and figure out.
Really good at it then. So if you
Thank
think
you.
it's the easiest, you're welcome. What is the most rewarding aspect?
I think it's when you get a phone call and it's somebody saying, just calling to let you know that I have 6 months today, or I ran into a former client at the grocery store the other day and he came up to me and gave me a high five and said I just celebrated 9 months. And so those little moments where it's, you know, somebody,
you realize, like, oh, I am making a difference, you know? Like afterwards.
Yeah.
Because you don't always see what happens when they leave.
Right, because we see a lot of them if they come back.
Yeah, exactly.
So we know the ones that are struggling, but a lot of times we don't hear from the ones who are doing well. So when you do, it's rewarding.
That's awesome. What are the current major macro issues in this area of practice?
I think stigma is always a really big thing in the field of addiction, that, you know, I think we've made lots of progress, but it's still a problem. And then there's the other side of things, like the insurance. A lot of times we see clients who insurance companies dictate their treatment rather than their clinical needs. And so they'll be cut short from a higher level of care, and they'll come to us with maybe only a week of inpatient.
Yeah.
So they're still really struggling, and then they're thrown into this lower level of care, and it's difficult. So insurance and coverage and, you know, all of those types of things I think are a bigger picture sort of issue that we deal with.
That's interesting. All right, well, that's all the questions I have for you. Thank you so much for meeting with me.
You're welcome.
I would love to work at Unity Recovery Group as a therapist for substance abuse clients. It would be a rewarding career. Shannon was very insightful. Interviewing her allowed me to get a better understanding of what I will be doing once I have my master's in social work. I will be an amazing therapist because I have empathy for clients and most of them would be able to relate to me easily.